Friendly reminder to rate, like, subscribe, and follow Teach Me Good wherever you listen to podcasts. Pretty please. It helps us out a lot. Okay. Now that you've done that, go check out our Patreon where we're trying to save up to talk to Tony Hawk via Cameo. Plus you get lots of perks like a mug and exclusive episodes. Love you. Enjoy the episode.
Welcome to the Teach Me Good podcast with your host Art Kai. Soon you'll hear from him and his friend Fernando, and later they'll talk to a special guest who will teach them about something. Not everything will be accurate, but hey, we're all just trying our best out here. Yeehaw! Enjoy.
Good morning.
Good morning. You know, I woke up today wanting kids.
Yeah.
You know how women get baby crazy because it's like they get to that age of like it's time to have a baby.
I mean, I don't know about this because I don't believe that women are reduced to only children and being mothers. But I mean, if you do, that's fine.
You don't believe in women.
I'm just a good person. So no, I don't know what you're talking about because, like I said, I don't reduce women to that.
You don't think you ever met a woman who's like, I want a baby? Because I've met a few.
Sure, I've met
like,
an individual person that happens to be a woman that wants children. Yes, I have met that person before. But would I attribute that one person's characteristic to all of women? No. Thank you. No more questions.
I didn't say that. I'm saying some women get baby crazy.
Yeah, it's some people,
Yeah, that's what I'm saying. I woke up, dude. I've been baby crazy off and on.
I feel like just reducing people to their gender just by specifying that they're women. I've met some women, sure, but I've also met some men. I've met some of they thems. I met all of these people, and some of them have been baby crazy. Some of them have not.
Okay, well, either way, what I'm trying to say here is I woke up wanting kids today, and sometimes women feel that way too. And you're right, sometimes other people feel that way, but I've never met a dude who's baby crazy.
Okay, sure.
Have you ever met a dude who's baby crazy?
But to be fair, Art only hangs out with women, so
yeah, it's specifically baby crazy women.
Yeah.
So my whole worldview is skewed that way.
Yeah.
This
is an uncomfortable intro.
Why?
But yes, I have met people that are baby crazy. I have met these people, and I guess today, this morning, specifically, you are one of those people.
Yeah, I woke up feeling like I could have 6 kids right now. I would love. Yeah. In bed.
You wouldn't have them. Your loving, adoring girlfriend would have them.
Jesus Christ.
But way to take credit for that one, Art. Way to take credit for the work that your significant other, the love of your life, would be doing for 9 months. Or what's 9 times 6? What is that, 45? For 45 months?
Yeah, straight. So just have one baby after another.
You just woke up today and decided you wanted to put your loving girlfriend through 45 months.
Yeah.
Of what they call just a very magical time, but also seems like a very painful time.
What do you know about childbirth?
I don't know anything about it, and that's the point. I just know what I've been told. And so really,
that's why we're here.
I think it's very interesting that you woke up and decided, yeah, my girlfriend is going to have 6 babies. I didn't even consult her about that.
No. I didn't even say I just said me. I can be a single dad. I don't care.
Sure.
I can adopt.
Mm-hmm.
They gotta be baby though. I can't just adopt like a teenager.
Mm-hmm. Okay.
I wish guys could have
like some seahorses.
Yeah.
Like seahorses.
Yeah. Is that a thing? Can male seahorses have kids?
Yeah, male seahorses are the ones that give birth.
That's sick.
As somebody that is a feminist, again, I did research all ways that men can give birth. So like I've actually been like learning how to use the technology CRISPR so that I can combine human DNA with seahorse DNA so that I actually can give birth to my own children.
I like how you're like researching how you can do this even though you are 20 something years old already. So you'd have to go back in time before you were born to genetically. You're saying you want to genetically modify yourself right now.
Yeah, well, yeah. Well, my whole dream is to also just be such a prodigious CRISPR CRISPR user.
Yeah.
I don't know what you call CRISPRite. I don't know what you call CRISPRs, but
Crispian.
Yeah,
Crispian?
yeah. That I just want to be able to actually modify my current human self. Yes.
Yeah, I feel like if you had access to CRISPR, that shit probably is so addictive. You know?
Yeah,
probably
no,
like...
I feel like if I could modify, oh my god, someone with low self-esteem like me, I would be a totally different person.
Dude, it would change the field of plastic surgery because you could
know
just
what's funny
genetically change it.
Is I would never stop being 5'7". I would change everything about myself. Would stay 5'7".
5'7". There was a story that came out of LA, of course, of like this doctor that specializes in giving men. I don't forget what it's called, but it makes them taller. And the dude who did it was 5'7". He got to 5'10". He you have to like break your femur and insert like a hip or a bone from your hip or something.
That's the thing they do in China, yeah.
So you could be 5'10", but you wouldn't want to be.
No, I think people. I mean, this is to get really off topic, but like I think people guys put too much weight into their height. Like, sure, there are women that don't want to date, or people that don't want to date people because of their height. But I feel like it's not as big of an issue as people make it out. Because, like I said, I am not 5'10". I am shorter than that. I am a height that is considered short, and I'm gets and mines. You know, like it's not a.
This feels like a weird brag. It feels cool, dude. I guess.
Yeah.
What do you want me to say, dude?
Real good. Let's cut this part out of the pod. You're right.
No, we're keeping this.
Well, all I'm saying is I feel like people make it out to be more than it is. I feel like when people talk about that.
Wow. Well, all of the incel demographic of our podcast are gonna come at you.
Yeah.
This is bad.
Because I also find that like people that I've met that are like 5'7" they also have girlfriends. Like a lot of them are dating people and they're like, it's so hard being short. And I'm like, it's not. Okay, it's also fun climbing on shit. What are you talking about?
It's funny that you think that like tall dudes can't climb on stuff. That's
yeah, but it's like I have more opportunities. You know, Like I have high cabinets, and sometimes I gotta climb a little bit to get to the top of the cabinet.
One of my old roommates was a short dude. I think he was like 5'6", 5'5" or something. And he was talking about hooking up with taller women. And he's like, yeah, it's kind of fun. You get to climb on them. I'm like, that was a weird thing to hear. That was a weird.
Nah.
You get it.
Yeah, that dude's climbing. The fucking mountaineer over there.
It's funny because he's like a handsome dude. He's like a good looking dude, which is why he also gets his. And he was like, yeah, sometimes you're just like climbing around. I'm like, that was weird. That was a weird comment. That's
funny. What are you talking about? That would have made me laugh. Yeah, I do. I just, yeah, I know I just did blow itself into a tangent. But yeah, I think that people, I think guys in particular put too much, or like sometimes you'll have guys that date taller women and they will seem kind of insecure about it. And I'm like, dude, they're into you already. Why are you insecure? They're into you.
Right.
It's fine.
Zendaya and Tom Holland have changed the course already.
I don't know. I just kind of find that like if someone's not attracted to you, that just means that it was not meant to be, and it's not really. It's
not really love.
Yeah, like someone that is gonna be attracted to you and someone that you will have fun with will not care. And there are so many people, especially we live in New York City, baby.
Yeah.
There's so many people. You're going to find somebody. It's not a big deal.
Well, unfortunately, that's not the case with having children. You're kind of stuck with the kids you have. Well, you got it. Because today we're talking to a doula.
Doula.
A doula, which I'm going to have at my own child.
What is a doula, Art? What is a doula?
I think a doula is like a person that can give babies. They
give babies. It's like a stork?
Yeah, kind of.
Okay.
They get stork vibes. The person we are talking to today is stork-like.
Oh my god!
Not at all. I
hope she does not hear this intro.
What I mean is storks are tall, and she's a tall person.
I feel like me and her are like the same height.
No, dude, she's like at least 5'10". Anyway, she's a friend of ours.
Very good friend, very sweet person, very fun.
Yeah. But no, she is a doula, and she like delivers babies, which I think is what they do.
Also,
right?
I feel, I think they help. I'm be honest, I don't know. I don't know much about all. Like even when I hear the word doula, I'm just like, I feel like I'm saying this. I feel like shouldn't be saying this word.
Well, my mind goes to two places: douche and duva, like duva cups.
Right. Wow.
Diva cups.
Yeah, you really pigeonholed the gender aspect of this again.
Well, those are. I mean, the words sound so similar, and they're all related to like the genital area.
Yeah.
The general genital area.
Yeah. Doula also sounds similar to the name of our guest.
Now this feels offensive.
Danielle
Deluty.
Deluty.
Do you think they ask her about that when she's like interviewing? Deluty. Danielle,
Guys, if you could
I'm so sorry.
Doula with Deluty, please do that and send us an audio clip of
She's
it.
gonna be so pissed hearing this intro. Like,
No, I'm sure
how
she's
are you
heard
guys? Yeah, probably. Yeah. All right, well, guys, enjoyed this episode. Our conversation with Danielle Deluty, the doula.
Sure. Hi, my name is Danielle Deluty, and I'm going to teach Art and Fernando about being a doula because they don't know where babies come from.
That's true. Actually,
Yeah, not at all.
Never had gotten to talk, so I don't really know.
And
frankly,
I
what
didn't
baby
either.
is.
I didn't really get to
Really?
talk either, yeah.
And now this is your
Does anybody get
profession?
to talk?
I think
Some people do.
collectively, at least, like, I can only really speak about, I mean, I can really only speak about my own experience, but, like, America seems to be
Not getting the talk.
Anti-talk?
really not getting
Pretty
the talk.
repressed.
Pretty collectively ignorant about childbirth.
I don't know. I feel like I have a few friends who talked about getting the talk. I remember that. That was a hot
I think
take.
people just kind of figure out. Like, you just learn
Yeah.
it through, like, osmosis
Yeah.
almost.
Well, was the talk that you got or that your friends got more about, like, hey, if you have, like, penetrative sex, then that could result in pregnancy. But then it sort of ends there. Like, no one's
Yeah.
telling you, and here's what to expect of pregnancy and childbirth. No one
No.
knows anything about
No.
childbirth.
You're right.
Hashtag not everyone.
Not everybody. Yeah. Some people know a little
Some
bit.
people know a bit, but a lot of people just
Did you guys have sex ed where you
talk about it.
saw it happen, like the birth?
I don't recall seeing childbirth in
Yeah.
my pretty paltry sex education in my
Interesting.
Orthodox Jewish schooling.
Really?
Mhm.
Yeah.
Did you guys learn about how pregnancies and childbirth happen though? Like in a textbook?
In a textbook,
Yeah.
high level kind of way.
Right,
It was
right.
still kind of vague. I feel like it took
Cerebral.
a while for me to understand the mechanics of like, wait, what goes where?
Yeah. Well, how hard? Yeah. How crazy? It's not that. Like you said.
It's pretty
Osmosis.
intuitive.
Yeah, you
Yeah,
get it.
but if you're
Not
like,
really.
if you're very, I don't know, the culture I was raised in is like very cerebral, almost like disembodied, just
Yeah.
very academic, like just
Detached
not
from
in
a
touch
any
with
personal-
our bodies. Like I didn't know I could masturbate as a person with like my genitalia until I was like in college.
Whoa.
Interesting.
Yeah,
Okay.
I like
Wow.
was shamed out of the curiosity
Yeah.
and just. Yeah, horny kid like
Yeah,
everyone
sure.
else, but was just like, well,
What do I do?
Just
Yeah.
like ignorance.
Yeah.
I don't know. Didn't even know
Damn.
what to do.
Interesting. Did you ever
So
have
that's a little bit about me.
Yeah, a lot to unpack. Again, we were
Yeah.
talking about it before the episode, but your background's very interesting. I wanna get into. We're not talking about that though. We're talking about childbirth.
We're talking about
specifically.
childbirth. Yeah.
Did you, quickly though, did you see a video? Did you guys have sex ed where you like saw?
No, I'm from Texas. We did not have sex
There's
ed.
nothing.
They believe
There's no
in
sex
just-
in Texas,
It's
actually.
literally just
Yeah.
abstinence only.
Yeah.
And I think
That's fair.
DFW, where I'm from, has one of the highest STD rates in the nation because of that.
A lot of births.
Teen pregnancies is rampant, and then people
Yeah.
are just passing STDs left and right.
Yeah,
uh,
that's fair.
And
That was a big day in my
that's how I grew
school.
up.
I remember
Was-
it was birth video day. And we
Whoa.
just like I went to a Catholic school too, which is crazy.
How was that? How was the video?
It was like everyone. It was like that week. Like everyone that was talking about it. It's like, oh, you guys are gonna watch that video. Like it's looking crazy. And then like
I'm
we watched
curious.
it.
Like, what
Yeah.
was it like? Whoa, that's crazy. That's gross. That's gnarly. Or
Yeah,
okay.
it was like a
I've
lot
seen-
of fluids.
Yeah, I've seen these
saw.
videos. They're not as intense as people make them out to be.
I think it's a lot for a teenage boy to take in.
maybe, yeah.
Yeah,
Well,
to
with
see
like
the whole baby
no,
come out.
No
with no
context.
context and
Yeah.
no kind of like sensitivity around it.
Yeah.
Like, hey, you're about to witness this amazing paradox where someone is
Yeah.
the strongest and the most vulnerable they're ever
Yeah.
going to be, and there's this portal to life, and you're
Yeah.
going to see a baby emerge. Like,
Yeah.
it's very fear based, like
Yeah,
the
yeah,
way
yeah.
we're shown.
Which it shouldn't be.
no,
I think it really. That's a good point. In that I was thinking about how like I really do think they showed it to us to be like, hey, don't have kids right now.
Yeah.
This is
So you-
crazy.
unless
had
you
sex
want
ed.
this horror
Did sex ed,
show.
yeah.
Okay.
You what?
Yeah, that's cool that you had sex ed.
Yeah, in a Catholic school, which I think is pretty
Yeah,
progressive. of
that
us.
is pretty cool.
And so
Yeah.
me and Danielle just grew up repressed.
Yeah, you guys
Yeah,
you guys are the weird
yeah.
ones here.
Yeah.
Catholics-
I
Catholics
also
are
did
right.
not masturbate until I was 19
Sorry.
years old. So
Are you serious?
No,
That's wild.
That's so nice of Fernando to try to like relate.
Yeah,
to
I was
me.
trying to
make me feel normal.
Yeah. No, neither of us have ever masturbated. So
Wow, and
Yeah.
that's really special.
we are pure people on purpose. Anyway, we're bringing this back to you.
Yeah.
So we talked about this a little bit. You went to law school before you became
Yeah.
a doula. What is
Yeah.
this? Give us the context of your life.
I'll give you kind of like the overview, not like an elevator pitch, but kind of like the condensed, easy to digest, linear sort of, here's how I got here that I like give in interviews when people are seeing if they want to hire me to be their doula. And I'll also just say, when I work as a birth doula, which is primarily an emotional support companion for people through childbirth or through the reproductive cycle. I work primarily with a partner. Her name is Tina Russo. She's freaking awesome.
Damn.
So we get hired like as a two-person team. That way there's always a backup and the family knows both of us. So I work as a two-person team. That is just an important detail. It's not just like the me show.
It's a very normal
Not
thing.
always,
Okay,
but it is
interesting.
quite common.
Yeah.
At least for Tina and me, I don't know how both of us have found, like, I don't know how I would do this sustainably on my own without like a person to process it with and to bounce ideas off of. And I just feel like we give better support because we're supported together.
And is a doula the same? It would be similar to a midwife, or are there differences between the two?
Very, very big difference. Very great question. A doula is not a clinical job. So it is not regulated the same way that clinicians are. So there's no licensing process. There are different organizations, like there is this sort of small kind of doula training industrial complex, if you will. There's like all these different certifying, I'm saying certifying in air quotes because it's not like a state validate or verified sort of thing. But there are these independent certifying bodies that train doulas, and so you do your own research. You find a doula training or a birth worker organization that aligns with like what you're trying to do or like how you view childbirth.
Are you part of one of these organizations?
She's rogue. She's a rogue doula.
I'm a rogue. I'm just a cowboy doula. But I trained with a couple of different organizations, and I feel a little differently about them now, just after doing work, like working as a birth worker. And I use doula and birth worker a little bit interchangeably. Okay. The origin of the word doula, I believe, is ancient Greek, and I think it means female slave. Not my favorite word, but that is kind of like the most common word that we hear, but and birth companion, a lot more syllables, maybe one more syllable, than doula. But like I did some research and found the organizations that I like was into at the time, kind of trained with them, and sort of continue taking like continuing education workshops on like more specific topics. But
so anyone could be a doula.
Yeah, like you could wake up tomorrow and be like, you know what? I'm a doula now. Some hospitals and some places and some birth centers like will ask to see like, okay, does this doula have any sort of training? Can you provide any documentation that you've like learned about childbirth before? But it is a rather unregulated situation, which
Art keeps on looking at me like he's like, we should become doulas.
We should be doulas.
And I'm gonna be honest, I feel like it's probably a largely female-based career. Would you say like there's? It's a lot
of women, and a lot of people identify as women, but it's not. But not all.
Yeah.
But a midwife is a clinician. They are an expert in the physiology of birth. Okay. And they. Yeah, like you go to school for years to become a midwife, but you're not a doctor in that you're not a surgeon. But you still have like clinical authority, and you can still be employed by a hospital if you're a midwife.
Interesting.
But a doula is more like a freelancer who you hire to support you throughout your pregnancy, and then comes to the birth with you, whether that's in your home or a birth center or a hospital.
Everything goes back to the gig economy.
Very much. Doulas, very much.
Driving Uber.
We're the Ubers of birth. I don't know. Yeah.
In a way, that's a pretty good idea.
Do you follow the couple or the woman from all the way from conception to childbirth? Or?
So it depends on the person. Some people will like start doing research. They want a birth, like a companion really early on in their gestation. So like people have interviewed us when they find out maybe they're about like 8 or between 8 and 12 weeks pregnant, which is on the earlier side of when we first meet people. Some people hire doulas when they're going through fertility treatment, like they're doing IVF or IUI. And some people hire us like 3 weeks before they're gonna give birth. They're like, well, I actually started thinking about it, and turns out I want a little more support.
Yeah.
So it's kind of a range.
Yeah.
But you mentioned that hospitals also allow you guys to like come through and like
totally.
you work in hospitals as well?
Most births that I've attended have been in hospitals.
Oh.
At least in New York City, that's where the majority of births happen.
Yeah. Okay.
I think because it's not because of an Ali Wong joke, but like Ali Wong has some joke like a doula is a white hippie bitch who like So I think a lot of people think a doula like hippie dippy home birth.
Yeah. It's a pretty good Ali Wong impression.
Which
that's like
damn. But I have yet to go to a home birth. I like can't wait. I'm so excited to be able to be support a birth at home. But the majority of the births I've supported have been in hospitals.
Wait, you said you haven't been in a home birth?
I have not.
Oh, wow.
Tina, my partner, has supported a number of home births.
Interesting.
Yeah.
How long have you been doing this?
Yeah.
I started training in late 2019.
Okay.
And Tina and I met in September of 2020, and like maybe January 2021 really like ramped up the number of clients we were able to support. And so so since working together starting maybe January 2021, we're approaching maybe having supported about 70 families together. Yeah, which I'm proud about.
That's great.
Why did you pivot from law school to being a doula?
Yes, that is where we started.
Well, they're similar careers. It's more
it's really like
birth the law,
birth
people.
Birth the law. Okay, so I'll give a little more context than I would give in a doula hire me sort of interview, but raised in a Orthodox Jewish community in northern New Jersey, very close to New York City, a lot of doctors, lawyers, finance, those are your options. Okay, so I was like, well, I don't understand numbers. As my dad's a doctor, he's annoying. Okay, like I'll be a lawyer. Okay. Always had a lot of other interests, but just had, felt like the social pressure of like, this is my option. So kind of convinced myself like law. Yeah, totally. I want to do that. Yeah. Went to BU law school. Nice. Not uncommon for a law student to wake up and be like, what the fuck? Whose idea was this? Who let me do this? Right. Me. I did, because I have agency, and that's what I chose to do. So I had this kind of epiphany, like, oh boy, this was not it. I also watched a stand-up special after my first summer of law school that totally changed my brain. Yeah. I was like, wait, I gotta do that. It was in law school that I started. Special? Rory Scovel's
stand up for the first time.
Stand up for the first time. Ooh. Truly spiritual awakening.
So yeah,
truly changed my life. But law school, I feel like a lot of people find themselves in college, and more found myself in law school. Yeah. And I was like,
I'm so lost.
Law, this is so dumb. Law is just racism in Courier New font. So.
I love that. We got to get that on a t-shirt.
Yeah. I got so many ideas for t-shirts. Also, another podcast.
Yeah, right.
So, in law school, realizing, okay, this is not the right fit. Mm-hmm. I had some really cool friends in law school. I met amazing people, and a bunch of them volunteered for a local organization in Boston called the Boston Area Rape Crisis Center as crisis workers, crisis response people. And so I was like, well, I want to do what you're doing. You're a good person. That seems really good and just a good thing to do, a good thing to be spending my time doing. So volunteered for this organization. So I was a crisis counselor on their phone hotline. Okay. So that meant that on I had a weekly shift where I would be the crisis counselor on the hotline. So I would field calls from people who were either themselves in the midst of a crisis in that moment, needed help safety planning, needed help navigating a hospital, needed help navigating law enforcement procedure, pretty intimidating stuff. Yeah. Or people would call in who were not in crisis in that moment, but were having some sort of emotional flare-up to something that they'd survived in the past. Okay. And needed help, getting out of an anxiety spiral, just feeling more grounded. They didn't need me to fix or diagnose anything, just listen, right? Yeah. Listen without judgment and be like, what you're going through sucks. Yeah. And your experience is valid.
Just like this podcast.
Exactly. I basically did this podcast for survivors of sexual violence.
Similar to us.
And I really connected to that work. It felt like there was pretty robust training, but it was a very like majority like emotional labor and pretty intuitive work, and just felt suited for me. So I was like, oh, I really like this. Kind of thought about doing that after school, but then I was like, if I move into crisis response full time, I feel like we're looking at a pretty quick burnout. That was my sense. Sure. So I started to like get curious, like, I don't know, are there other avenues or contexts where there's room for this kind of like counselor companion kind of role, right? Not a clinician. I'm not trying to solve or save. Like that is not, what I'm doing, but just to like witness and validate and hold and educate where that's appropriate.
Nice.
And all of this is because of Rory Scovel?
This is all, I want to be clear, this is all because of Rory Scovel. He's a comedian. He's based in Los Angeles, California.
He came on stage with a tiny jacket, and you were like, "I have to get out of here."
I was like, I gotta get to childbirth.
Wow.
That leap.
Damn, comedians are so powerful.
Yeah, comedy's really.
Us three. Whose lives are we gonna change right now with this podcast?
Oh my God! What lawyer? What lawyer is gonna be like? Oh my God!
Start a podcast. Be a doula. Yeah. Anyone can, apparently.
Yeah. I mean, not everyone could be a good doula.
Yeah, Yep. It's like anybody can play chess, but not anybody can be a grandmaster.
Yeah. Exactly.
Chess.
Yeah, I can't. I've tried so hard.
It's confusing.
It's like
easier
rules. I'm doing air quotes for rules. Like gross. I hate rules.
Easier to be a duel than to play chess.
Okay.
I don't. Hard for me to agree or disagree because I cannot play chess. But right, so a friend of mine who was doing her like medical residency, but she'd also been a doula before med school. She suggested, she was like, first watch the documentary The Business of Being Born. Okay, then
is that about doulas?
It's about birth and childbirth in the United States and kind of like the over medicalized. Just like the for-profit nature of like medicalized birth, and how that is a little very problematic. So I watched that. Just like also was a little bit less influential than Rory Scovel's special, but
the most influential comic of all time.
But she encouraged me. She was like, look into birth work. I feel like that might be a good fit for you. So I started reading about doulas. Truly, like, had not heard the word doula before. Maybe the year 2015, 2016. Just so unfamiliar. Like the culture I grew up in was very like doctors do birth, and it just like happens to women. Meanwhile, like the concept of someone non-binary giving birth, like, wow, that was so far away from like me growing, when I was growing up. But looked into birth work, and I was like, what? This is a job? You can just like accompany someone through this most like epic transition of their life? Like, hell yeah, dude. Like, I want to do that.
You're a hype person for this.
I'm a hype man for childbirth. That is what it is. So when I knew I was gonna like move back to New York City after school, and I moved with a very good friend from law school. We still live together. Nice. Shout out Lau. She's amazing. She's a public defender.
That's cool. That's very cool.
Yeah, she's excellent. And decided to dive into a number of different doula trainings. Did some research. I might choose different trainings if I were starting again today, but I'm whatever. Always a student. So
I like that philosophy.
So I started like the training, which is a little bit of a you kind of chart your own path kind of thing. Tried to join a few different like doula or birth worker collectives in New York City, and then found one that I like really connected with. It's called New York City Birth Village.
Nice.
And that's how I met Tina, my partner.
Nice.
And so we like starting to partner together has been like a tremendous part of the education, and like we've started supporting births together.
Nice.
So I went to a few before I met Tina, like supported a couple of births. Like a really close friend of mine trusted me to like be her doula, like a friend from high school, so someone I'd known for like 15 years.
Nice. I have a lot of questions.
But yes, great. Okay, cool.
Yeah.
That's the path.
The path. Yeah. What do they teach you in these like classes? Are they lessons?
Yeah, they're like workshops. It's like one. It'll be like a 4-day, 10-hour days. Like you're just working. It's like you and like 15 other aspiring birth workers.
But do you learn anything about I'm assuming they teach like physiology. As well,
Yeah.
like the whole thing,
Yeah.
Right? It'd be crazy if they wouldn't.
Yeah. you definitely learn about the physiology. There's a pretty robust reading list, so lots of pretty awesome books. Pretty like happy to like recommend good childbirth books.
Nice.
But a lot of the emphasis is on how to emotionally support someone through this experience and how to not center yourself. How to make sure that they are the center of their birth experience. Particularly in a culture or a society where we are used to a different kind of hierarchy, like especially because for so many people we like understand birth as this medical process, which I want to say it is not inherently, but so they kind of just assume like doctor, top of the of the food chain, or like head of the team, captain of the team, and it's like, well, no, the person laboring and giving birth, that is the center of the team, and the rest of us are kind of like filling in gaps to support them.
Yeah, I do have a question. You were talking about the business of birth in that video you watched. Could you go into like more detail, like some of the things you saw in that, and like instances of the commodification of birth and how we like use it for profit at this point?
So birth, I'll just say like childbirth is not rewind. A hospital.
Okay.
A hospital is primarily designed to be a place to take care of people who are injured or ill. And birth is neither of those things. Is it possible for complications to arise in childbirth that can be treated with the medicine and machinery and technology and expertise available at a hospital? Totally.
Yeah.
It's great for emergencies.
Yeah.
But there's Dr. Neil Shah, pretty amazing clinician and just mind in contemporary childbirth. He described, he was like, the only difference between the ICU, the intensive care unit in a hospital, and the labor and delivery floor is that labor and delivery floor, like there are operating rooms on that floor too. So if you put 99% of pregnant people who are fundamentally like the healthiest people in a hospital on a floor where there's such close proximity to operating rooms, like, you get a lot of surgery. You get a lot of intervention that is not necessarily medically indicated. It's not because of emergency. It's because we're in a hospital and the culture is this desire for control and for certainty and like, let us manage your labor. When it is it's a spontaneous, kind of mysterious physiological process that is not, just because it's uncertain does not mean it is an emergency. Right? Just because it takes an unpredictable amount of time to birth a baby, that doesn't mean you're birthing wrong. Like a slower or longer birth could be better. Like it allows the vagina to expand without tearing. Maybe that's like one brief example. But when you just immediately put someone who's laboring in an environment and there's much higher trust in the machinery around than there is in the person just going through the process, then you wind up with a lot of interventions that aren't always necessary.
That is interesting. Like the vibe of a hospital is like when you're there, it's like, we got to fix everything all at once right now.
Like we already have these tools. Why not use them?
And like obstetricians are surgeons. So there's this strange incentive misalignment. Like most people, I don't say most, but many people who are pregnant and are going to give birth, like, do not want to do so through surgery. Some people do, and I'm not trying to invalidate that. But for the people who don't, right, and then you want to birth vaginally, not surgically, but you are hiring as your primary, like clinical care person is someone whose expertise is surgery. And a surgeon, like, you got to keep doing surgery to like stay good at it, right? So it kind of makes sense. Again, hashtag not all doctors, but like it makes sense that a surgeon wants to do surgery, like that is their expertise. They know that they can do it really well. But it's kind of like thinking about it in a vacuum as opposed to like, yes, and how can I continue to keep my skill set robust, as opposed to like the skills of a midwife who are hands off, very like trusting in the birthing process, and not like running to intervene with all of the things available. And also, right, like you can bill more for surgery. And I want to emphasize, like, I don't think most doctors are running around like, how can I squeeze all this money? And
you're not anti-doctor.
No, not at all. But the culture of Western medicine and like certainly for-profit healthcare environments is just like that's not.
Gotta make that
that's
coin. Gotta get that bag.
Yeah, and like a lot of the policies in a hospital are not like evidence-based in the best interest of people who are giving birth. Like almost every hospital, a person coming in giving birth, like you're not allowed to eat or drink. You can have some clear fluids.
Yeah.
Okay, you're about to reach like the apex of human strength. Like talk about a marathon. Like you need calories to do that. Like, what do you mean you can't eat or drink?
Right.
That policy is like more like designed for convenience and for like liability reasons. Like, well, because in the event that we have to do surgery, we have to pivot to surgery. It would be easier and like better if the person has to go under general anesthesia, if we kind of limit what's in their stomach so that they don't throw up and choke on their vomit, or like so that it's just easier from like incision to delivery, like we don't have to move around all the food or whatever it is. But that's like you're putting the person laboring last and like hospital like convenience first.
When did this transition happen? I feel like before a certain time most of these births probably happened at home.
Yeah.
In like another birthing perhaps area.
Yeah.
When did transition happen to like mainly hospitals?
Yeah.
I guess in the 70s when healthcare started to really ramp up. I don't know.
Yeah.
Yeah.
So in the 20th century is like largely when that like pivot happened.
Interesting.
And right, there was this kind of like, I don't know if I would say binary thinking, but like thinking of control and comfort, trying to eliminate pain from childbirth and trying to optimize for convenience.
Yeah.
A lot of that happened in the 20th century, and there was this thinking, right, which is also like, in a big picture, like very, very patriarchy, very capitalism of like, how can we optimize birth? You know, like as if a person's body isn't the best way to do it. So you had things like called like twilight birth, like they were introducing like forms of anesthesia and like pain management that like you get knocked out for birth, like not awake for your birth, and like strapped down to tables. And it was just this idea that like nature and like the wildness is bad and we need to control and like
humans have a habit of like trying to make things so efficient that they take the human aspect of things out of it, and they
100%.
Capitalism, baby. Make it as convenient as possible for us.
Yeah, but
no
like
pain, no feeling.
Exactly. And like since the 70s, there's been like hundreds of % increase in like the number of surgically assisted births, cesarean births, which is not the same, but it's almost like a similar percentage jump as like incarceration, where it's like, what the fuck is going on? Like this can't be because...
Are you saying C-sections make people criminals?
Yes. Thank you.
That's what the C stands for?
C for criminal section.
Criminal section.
Yeah. But right, like the increase in like heavy medical intervention, surgical intervention is just so astronomical. Like it's sus. You know?
Again, you're not against surgery.
Of course not. No, of course not.
Your dad's a doctor.
Yeah.
You gotta support the family at the very least.
At the very least.
Yeah. It's just funny, like I feel like people may listen to this and be like, this person doesn't like doctors and hospitals. Like I don't think that's what you're saying.
I really hope that that's like not the takeaway. I know like the way I grew up thinking about childbirth was like absolute fear. Like, oh my God, it's the worst pain in the world. It's so scary. You're out of control. Like, I need help. I don't know how to do it. Like all of this fear. Yeah. And if you can grow a baby, like you can birth a baby.
Our bodies are made for that.
Our bodies are not.
But that's just how it works. You give birth. And something that Tina and I talk with about everyone, and this is a distinction that we learned about from a book called Transformed by Birth by Dr. Britta Bushnell. Highly recommend it. It's a beautiful, beautiful book. pain, yes, is part of childbirth. When your uterus contracts, the sensation is, for almost all people, a painful one.
Yeah.
Pain is not equivalent to suffering.
Sure.
It just doesn't always mean suffering, right? Unlike an infection or a broken bone, like the pain of a uterine contraction does not signal that something's wrong. Yeah. That like something, pain, we
it's not like panic pain. Yeah.
No, it means, the uterus is contracting. Birth is like labor's happening.
Yeah.
And that doesn't mean, like, knowing that the pain doesn't necessarily mean suffering. Okay, that doesn't necessarily make it feel better, but it's really important to, like, mentally prepare for childbirth and to understand, like, the pain is not bigger than you. It is you. Like, it is your body laboring. As a doula, as a companion for someone in childbirth, like, we're trying to read the room constantly, like read the person, like, are they crossing the threshold from pain into suffering? Because that's something. Well, then we got to pivot how we're like, we got to change how we're supporting you. Bring in some different kind of coping mechanism or tool, but that you're experiencing pain, or that your partner who you're watching, your spouse is like giving, if there's a spouse, like you're watching someone you love the most experience pain. Our assumption is like, oh, that's bad. Pain is the enemy. Pain is the villain of the birth story. We got to eliminate it, get it out of here. And it's like, the pain tells you something. It's this like productive pain, so to speak. Which again, like, it's not comfortable. Like childbirth is not comfortable. But a lot of people I notice like have this attitude of like, I'm gonna do an epidural because I believe in modern medicine. So, and an epidural is like anesthesia to that's medicalized pain one version of medicalized pain management. And I just, I'm not anti-medicine. I'm not anti-epidural at all. And a lot of people also think, doulas, that's for like unmedicated childbirth. Like crazy. A lot of the births I support, people opt for an epidural. Epidurals are amazing, and they can be the best thing for someone. So,
Interesting.
But like pain is not suffering, and like that's important, and that's also a pretty different attitude than like a lot of clinicians I think have.
It sounds like your job is very like, how do I inject compassion into this whole experience, and like being present and making sure that they feel like present and compassionate about this whole situation. It sounds very Buddhist, honestly.
You're like a support system. You just offer a support system for this person.
I'm like sometimes I feel I'm like a mom with boundaries.
That's fair.
Like
I feel like every mom should also have boundaries, but it's also a mom. You feel like a mom.
Do moms ever have boundaries though?
That's a good point. I don't know.
Some sure,
but no, I don't think my mom does.
Like, I'm not there to persuade you. Like, get an epidural, get a C-section. Don't do this. Like, my agenda is like the person's agency and autonomy is protected, because that is what I see a lot like threatened
away of,
in a hospital is really like not taking the person seriously, really like glossing over consent. There's a lot of unenthusiastic consent that I see, and like trying to make a little more space and like really give the person some time to make a decision. Like, so you don't have to agree to that. Do you want to talk about it a little bit more?
You do a lot of mediation then, right? It's just like you're sort of like the bridge between the doctor.
Sure.
So it is like law almost.
Yeah,
sure.
You feel like a lawyer in a way.
There is advocacy. For sure.
Right,
and like anyone who is going into a hospital for any kind of procedure or process, whether it's childbirth or surgery, some kind of surgery or illness, whatever. You have to, unfortunately, like you have to wear your own sort of advocacy hat because of the profit and like sort of domination kind of culture of like, we know better than you. Like there's a lot of room for your consent to be kind of second, like not a priority.
Right. But you're there to be like, no, I see you. I hear you.
Exactly.
I'm going to convey this.
Exactly.
You feel good to, and they like trust you to do that. That's so cool.
Yeah, thanks.
What a crazy... We could do this. You and me could be doulas.
We could be.
I'm a very present, compassionate person.
Well,
you
then
are
you'd
not.
probably be...
He's not. Actually, you could not be a doula.
No, I think I could.
No.
I want to say, though, we don't, like, at least with Tina and me, like, our philosophy and many excellent doulas would not... Like, we don't take the place of someone's partner. If there's a partner. We do support lots of single parents.
Right.
But we don't... like try to step on anyone's we have a
Right.
specific role.
Sure.
We're not your primary partner.
Right.
We're not a clinician, and we're
Right.
not trying to create any antagonism
Yeah.
or like we're
You're
not
there
trying
for
to
the
disrupt.
assist.
Yeah,
The
yeah.
assist, and that's it.
Yeah, I don't think I'd be good at this.
Yeah, no, Art likes to step in. Yeah,
Yeah, I'd be like, yep, let's do that.
yeah. Art be like, what can I do? What can I do?
Yeah, yeah.
Well, yeah,
Just
that's
give me
the
some
thing.
space.
Exactly.
Yeah, that's
Often
fair.
it's like there's no like. Often there's no action items, you know,
Yeah.
in birth. It's really like get through this contraction.
Yeah.
Right.
No.
Interesting.
Are you just text someone as they're in labor?
Yeah. So
What's up? What's up?
I'm just chilling. What are you guys doing?
Yeah.
What are you guys doing after this?
Yeah.
You want to
I
get
would
food? You wanna get soup?
We
Yeah,
let
that's me.
them text us first.
Right.
Okay.
What was your first birth like? Do you remember? I'm assuming
I
it's
do.
hard to forget, right?
Yeah.
Yeah.
The first birth that I like witnessed and supported in
Yeah.
person was someone who she was a second-time parent,
Nice.
and second-time births tend to move a little faster than
Mm-hmm.
first-time births, and so I was kind of surprised by how quickly everything moved.
Interesting.
But this birth was at the Brooklyn Birthing Center, which I actually am not quite sure what their status is now. Unfortunately, like birth centers do not like get the funding that they deserve.
Yeah.
And so it was like non-existent for a little while, but I think they might be back. Anyway, it was at this birth center I think it was in like Midwood or like a little
Okay.
bit further
Further,
south in
yeah.
Brooklyn. It kind of looks like a house. Like you
Yeah.
like walk up the steps, it looks like a little house that's been transformed into like a clinical practice or
Yeah.
something. And there's a bunch of bedrooms and they're all like outfitted for birth. So there's like a big tub, there's a toilet, there's like
Yeah.
a big queen size bed,
Yeah.
some machinery. It's very cozy. There's like twinkle lights everywhere. It's very like warm.
It's nice.
Yeah.
I want to go like hang out there.
Yeah. Let's go hang out at a birth
I don't want
center.
to get birth. I don't want to doula. I just want to be. That sounds nice.
Yeah.
Like an Airbnb, but
Yeah, it's a little spa.
Yeah.
That sounds nice. Were you nervous going in?
Sure.
Yeah.
Of course. Yeah.
Of course.
But I
Yeah.
think part of the nerves is also like, I'm not gonna know what to do, and it's the
Yeah.
thing. It's like you don't have to do anything. You just
Yeah.
have to be there and like
Yeah.
witness this person and like be present with
Wow.
them and like
And
help
just
them cope.
listen
Yeah.
to their needs.
Yeah.
Yeah.
Did you cry when the baby came out?
I don't. I have cried at,
Yeah,
at
yeah.
births, but I
think I
don't
would
think I
cry.
cried
Yeah.
at the first one. I don't think I cried,
The
but
idea
I
of
don't
a birth
even
makes
remember.
me tear up. I'm
Really?
honest. Yeah. Oh yeah.
Why?
It's just crazy. Just like a crazy, like we've so many. I can't even describe it. There's so many thoughts are going through my head right now. Why are you looking at me?
Feels like you're lying.
No, okay, so this is where my brain goes. It's like this is what we've been doing for so long, and like it makes me think about how I got here, how all of us got here, and it's just like so many of these experiences of birthing, and then you see it, and you're just like, wow, it's like a tiny human, and it's like, wow, they like are just genetic clones of these two parents, and it's just like so many thoughts that come to my head. It's just like reflective of the continuation of civilization, I guess.
Yeah,
And it's like
it's-
sort of a bigger picture, but also like such a micro, like localized situation that like reflects a bigger thing. It's crazy to me.
Yeah.
And that makes me emotional.
Yeah, it's
Yeah.
very personal. It's also like very primal,
Yes.
which is like not a frequency I think we're all like
Totally.
operating on a lot,
Yeah.
and that can also feel scary, I think, which is
Yeah.
yeah.
It's yeah.
Yeah.
Do you feel primal when you see you're like we're such animals?
In like the best way.
Yeah, right. It's
Right,
not
like,
like a bad thing.
especially when I'm supporting someone who like has like cultivated a lot of like trust in themselves, like and in their ability, like
Yeah.
when it's time to start like bearing down and,
Yeah.
and pushing,
Yeah.
right? The standard way that a lot of us have seen, thanks to like friggin' Judd Apatow movies, is like a woman on her back like screaming, and then like
Yeah.
a baby comes out. Okay, that position, like pushing a child out on your back. It looks like you're gonna say
Yeah, I
something.
was just gonna ask about that. I've read that like putting the woman in like stirrups and everything is probably one of the least efficient ways to actually give birth.
Yeah, and again, this is another thing. Like, I see plenty of people birth on their backs, and like that's the most comfortable place for them. But largely speaking, if you kind of like let someone birth on their own, like they would get into a position that doesn't look like that.
Yeah.
And that is a little more like efficient.
Yeah.
Right. That position is not. Gravity's not really on your side.
Right.
It really is primarily for the convenience of the clinician who is going to like quote deliver your
Right.
baby.
Just get in there easily.
Yeah, there's a spotlight that comes down from the ceiling in the
Wow.
hospital that's like just on the crotch,
Yeah,
and
yeah.
they're
Like a
just
dentist's office.
Yeah.
Exactly. It's like a dentist light on steroids. Yeah.
Wow.
But yeah, like it's amazing to watch people kind of push back against that sometimes and say, oh, you know, I'm more comfortable on my side. Like I want to be in the bed. I want to be in a more restorative position, but I can tell like the baby feels better. The baby likes this side better. Yeah. They like really intuit this, and like there's a lot of trust.
That's where you come in. You're like, yes, that's what we're doing.
Yeah.
Like I believe, I trust you, and this is what you're gonna get. Yeah.
Exactly.
Wow.
Exactly.
Interesting.
Yeah.
I'm trying to imagine like by the 70th at home. Do you feel pretty? Does it feel pretty powerful still, or how do you feel about it now?
Yeah. Like it's kind of how I feel. Why I feel like, I feel like I picked the right thing now. Like, like
a bad question.
It has not gotten old yet. I'm not like desensitized to it.
Right.
I am like more and more familiar with birth, and like, but it's becoming more and more normal, like in a good way. Like, birth is freaking normal. Yeah. You can do it. Yeah, it's really fucking hard and it hurts, but you can absolutely do it.
Yeah.
Which is pretty cool.
Yeah. Have you had any bad situations where you're just like, I gotta really like crisis manage this right now?
I mean, I've like witnessed trauma happen, and Tina and I, like, we want to mitigate the chances of birth trauma. We want to mitigate the chances of things happening too fast, too soon, with the person, like without the person's input in it, right? But we can't. We're not like saviors. We can't save everything, or protect from everything.
You're human.
And so I have like witnessed people's autonomy like be compromised. I have like witnessed racism, and it was fucking frightening.
Right. Have you like witnessed a really complicated birth and just like had to deal with that?
Yeah. Damn, but there's I had a someone who experienced something quite rare called placental abrupture, which requires an emergency, like a emergency pivot to surgery. And this person had been laboring without an epidural, so they didn't have any anesthesia hooked up to them. Because the team needed to move so fast to make sure that the baby could be born, they had to put my client under general anesthesia, which means that she wasn't awake for her birth, which for many people is like devastating. She at least in talking about it, and like who knows, like she'll continue to process it, but her experience was very like, no, I felt like everything was explained to me. The team moved really fast. My baby was born. Like it moved in a way where I felt like I trusted my team, and I felt like I was being taken care of. So that's a situation where maybe on paper it looks like, oh, traumatizing birth, and yes, there are elements of trauma for sure, but like her recollection of it or her experience of it is not like this negative. Right. She and I can't speak for her, and I don't want to say like and she had a great birth, but it's like so nuanced and so dependent on the person. But also witnessed someone like move into general anesthesia not under those kinds of circumstances where it was very disempowering and it sucked.
Yeah, it sounds like a lot.
Yeah.
I feel like birthing, the whole business of it is a lot. There's a lot to take. There's so many moving parts. Just like things to consider that you don't really think about, especially as a dude. But there's a lot going on.
There's a lot going on.
Damn.
And then I know when you walked in, you were talking about getting a text from someone regarding like postpartum. Do you follow people after they've given birth to? And, like, help them
So if Tina and I, when we support someone like through their birth, we always visit, like they'll see each of us at least once postpartum. Okay. So we'll come for a few hours to their home.
Nice.
And I also do some more extended postpartum support. So like I have a client who has twins. I was not part of her birth. She was like, no, I think I've got good birth support, but I know I'm going to need some more help postpartum. But I want someone who's like a little more collaborative, who can like take care of me and my babies.
So what do you do postpartum? Like what did they ask for?
So the way I see postpartum care, first I'll just say postpartum, like the postpartum period, kind of an amorphous period. Like how long is postpartum? Like how long does that count?
Exactly.
Some people talk about it like the 4th trimester, right? So, or like the first 40 days after you give birth. For some people, they say like it takes about a year until they like really feel back to like, you know, quote unquote normal. So it is very variable, but certainly like the immediate month and a half after birth, you need a lot of care. You need a lot of
emotional
rest.
support, or it's just like, what do I like? No, literal like support. Like, what do I do with my body?
Yeah, physical and emotional. So in the American specifically American, like if you go to like England, which is also like, you know, Western medicine is like, you know, reigns supreme. They have much more robust postpartum care, like more check-ins. A nurse will like come visit you once a week. In America, it's like you see your OB 6 weeks after you give birth, and then they're like, they kind of like look into your vagina and they're like, all right, well, you're good to have sex and you're good to keep working out. Looks good. Which is just so like cold. Disembodied and cold. And like no one ever mentions your pelvic floor, which like I'm not sure if you guys have any familiarity with like the pelvic floor, but like
never even heard of it.
That there's no attention to it is bananas.
It's crazy.
Just ridiculous. So postpartum, right, we have this culture of like bounce back, like get your pre-pregnancy body immediately, which is like so fucked up. When you give birth, you birth your baby and then you birth your placenta, which is another organ that's like almost all blood vessels. The wound on your uterus where the placenta was attached is like the size of a dinner plate. It's a large wound.
It's big,
and if people could see that, like on the outside, maybe we'd have paid leave by now. Probably not, but maybe.
Probably not.
But it's a real wound, but it's like the healing is invisible. Like the person experiencing it like sees blood, and, you know, like when you use the bathroom or whatever. Like you know to expect some bleeding, but there's a lot that goes into the healing and being set up so that you can rest, like actually rest. Like, no, don't vacuum. Like, don't be lifting groceries. Like, someone else can do that for you. Like, let's try to make it so that someone else can do those things for you. So certainly those first, like those immediate weeks after your body just did the most work it's ever done.
Interesting. That makes sense.
Yeah.
Do you deal with a lot of like postpartum depression?
So postpartum depression.
Is that a myth?
No. It's very real. That's typically depression's kind of fake. So postpartum mood disorders are typically not what's the word? Like diagnosed until maybe like a month, 6 weeks after birth. I'm usually with people like that first month, first 2 months. So I'm very much paying attention to their mood and like checking in with them. Sometimes like what do I do in a postpartum visit? Like we sit on the couch for a couple hours and they like process their birth. It's a really it can be a pretty isolating time. Certainly like most of my practice has been during COVID, like in a pandemic time where like no one's coming over.
Doing it,
You're like very alone or isolated, I should say. So but so all that to say, like I am very much paying attention to people's mood and like
interesting.
Are you feeling loved, or are you feeling okay? Like you're exhausted, of course, but
Is it tough to like have clients that are like hard to work with and just like you're clearly like not connecting with them and just like how do you deal with that? I feel like that's like so big. Like, so hard.
That's why like we always, anytime someone interviews us, we're like sleep on it. Like meet some other doulas too.
Have you ever passed on anybody or like this is not a good fit?
I don't. Not yet.
But you're not
I think
like
we have.
it.
But it's certainly true. Like some clients we like really, really deeply connect with, and then others it's like it's good. Like we did our. I feel like I did my job, but I'm kind of like I don't know, a little bit. Yeah.
Which I feel is again very human. You know.
Yeah, I think it's just like. It's about them, right? And so
as long as you do that,
as long as I like just give them the space to tell me how I can support them. Sometimes people don't always know, but making sure like they're driving, like they're in charge.
I like that.
But sometimes I'm like, let's hang, and they're like, I'm good.
No, you're like, okay. I'm busy too. Yeah.
Yeah.
That's fun.
Weird random question that came in my head.
Yeah.
Have you ever met anyone that ate their placenta?
Yeah.
Really?
Well,
Is that a thing?
not like fork and knife, like just eating
No,
it.
you
take a bite.
But most mammals consume their placentas after birth. Yeah.
Is that a thing? People do that. Humans do that.
So there's something called like placenta encapsulation. So
Okay.
like I know a lot of birth workers who know how to like basically like transform the placenta into like
pills.
little pills.
Yeah.
So
wow.
know a lot of people who do that.
Is that like good for you? Like for your skin, apparently, it's like great for your skin. Right?
Yeah. So like
I know.
I
Is that how you got your
encourage.
skin art?
Yeah.
Art's eating placenta constantly.
I just want to know if my placenta purchase was valid. I want to know.
And what if what about eating someone else's placenta?
Yeah.
Is that good for your skincare regimen?
I mean, Art does
Probably
have
not bad.
fantastic skin, so.
Yeah.
I
You do.
have
You sure
a
do.
skincare routine, dude. You got to get on it.
Yeah. Do you see this? I need to eat a placenta.
Yeah.
Ugh.
You ever ask for it? You're like, can I have a piece of that?
You guys gonna eat that?
That's why you're in it.
Yeah, there's a lot of. I encourage anyone who's curious about it, like read evidence-based studies and like there isn't one answer for anything.
Right.
Just in life, but certainly with
You're
childbirth.
pro-science. I want to make that very clear.
Yeah,
Danielle's
but like also with science, like there's this new study.
Do your own research.
Yeah, there's a new study called the ARRIVE study, which, long story short, we've seen a big uptick in a lot of doctors recommending that people induce labor at about 39 weeks of gestation, citing this study. I just want to encourage everyone, like, read the freaking study before being like, well, I believe in science. Like, because the data is like, mostly with like 20, it's like, it studied people
It's a very specific
very
group.
specific
Yeah.
patient population of like, 23-year-olds. Most of my clients are like mid-late 30s, early 40s. That's a very different body and situation.
Right.
So all of that to say, like, yes, sure, science, but like, not like in a religious faith, like uncritical approach to it.
Damn. Interesting.
Yeah.
Your life's crazy.
Thank you. Thank you.
You like babies. You're a fan of kids.
Babies are so
Babies-
cool.
It'd be great if she was like,
You'd be like,
I
nah.
actually disgust me.
No, so sometimes I'm
Nah.
like, fuck these babies. Like, I'm
Yeah,
not
yeah.
like I'm there for I'm there for the parents. Like, I
Right.
think the parents are
That's
amazing.
what I was sort of trying to, trying to
Yeah.
get at.
But I do hang out with babies like every week, and
Yeah.
I love that.
Right.
I really
Outside
do.
of your job, you just have a litter of babies.
Yeah, just have
Yeah, I
babies at
just
home.
sort of find them, and then I steal them.
Yeah, New York is crazy. There's just babies around.
There's just babies around.
Yeah.
But yeah.
Interesting.
But yeah, I do love, and like newborns are predictable in a lot of ways, and they're just like, they're sweet and they sleep a lot.
Do you spank all the babies?
I'm physically abusive with all of them. Yeah.
That's the thing, though, right? Like
Mm-hmm.
doctors do that to like make sure they like are breathing. That's the thing. No,
Yeah, like they'll sort of tap them.
that's not like a spank. It's not like,
But there's like different ways to like stimulate their back or
Right.
their face to like make sure that like you know,
Right.
they're like turning pink at least immediately after birth.
And, like you
but-
do that. Like you are in the position to do that. They sometimes the client wants you to do that sometimes, right?
So hit
Why are you-
their
why-
kid.
No. Like
no.
take the baby like after they're born and like try to like do all those like procedural kind of things.
So I don't do that.
Okay.
There is usually like a pediatric nurse in the room
Okay.
who's there to kind of like
Yeah.
check the baby out.
So you don't touch the baby.
She doesn't look at the baby.
After birth, I usually do not. I
Interesting.
usually don't touch the baby.
Yeah.
Ideally, like most people are interested in having like immediate skin to skin contact, like having their baby on their chest, like
Right.
uninterrupted for like at least an hour.
Yeah.
Especially if you're trying to breastfeed or
Yeah.
body feed, if that's part of like your goals.
Yeah.
Having like bringing your baby immediately to your chest is like one of the best ways to facilitate that.
Yeah.
But it's mostly postpartum visits. That's when I'm like,
Yeah,
yeah, can I
that's
chill
when
with
the
your
baby-
baby?
yeah,
You want to
okay.
go take a 45-minute shower and I'll just
I'll
like
chill with
catch
the
up
baby.
with your baby.
Yeah.
It's like really fun.
Right. Okay. That was starting to get a good picture of because in my mind I guess doulas are just like, oh, they come in, they like deliver the baby, they are there like taking the baby, like everything. But no, it's okay.
No,
it's, hype man. Yeah.
I would love to catch a baby one day. Like that would be so cool. And that is like the
Catch a
word.
baby.
That is the word that
Amazing.
they use.
Amazing.
I
Well, they do
have not
fly
done
out,
that, and
so-
it's not, and that is not
It's a
within my
canon.
job
Yeah, the
description
catcher's
technically.
mitt.
Yeah. I bring a mitt to every,
Yeah.
But my like labor support, like in the room when someone's laboring, it's a lot of physical touch if that's something
Yeah.
that they want. I always bring some like essential oils in the room. Again, everything I say, it's like with the person's consent.
Right.
Tina and I always bring like flameless tea light candles, a string of twinkle lights, which sounds a little like corny.
Set the vibe,
we literally
dude.
set the vibe, like
Make it as peaceful as possible.
exactly.
goddamn.
Like
Yeah.
hospital fluorescent lights and linoleum floors are just like not cozy, and the hormone.
For you guys.
Here's a little. Okay, this is also like the hormone that drives labor progress. Primarily, there's a whole hormonal kind of like cocktail, if you will.
Machinery
is
happening.
called oxytocin.
Yeah.
This is like the love hormone,
The
right?
cuddling hormone.
Yes,
Yeah.
it's like that's the hormone we release when we orgasm, when we hug someone we love, when we feel
Nice.
safe. Most mammals birth in like they'll find a quiet corner of a forest or a cave, somewhere that's like dark and
Yeah.
like lights aren't on you. You know,
Right.
you don't feel pressure. You feel safe.
Right.
A hospital room, right, with the fluorescence and the
that
beeping
dentist
and
light.
booping,
Right.
exact with the dentist spotlight. That doesn't feel like that's not conducive to the
Right.
uninterrupted flow of oxytocin.
That makes sense.
So a lot of labor support is like transforming the room.
Yeah, yeah.
Like doing a little,
Setting the vibe.
setting the vibe.
I love
It's
it.
fun and also like the medical staff usually really is into it. Like they'll
Yeah,
come in
yeah.
and be like, "Ooh, I love this
Yeah.
vibe."
Don't forget that medical people also are human, you know? They
Doctors
like-
are
they like a
people,
vibe.
nurses are people.
Everyone's human.
Not in my book.
Yeah. They are just capitalist pigs in your book. Amazing. I feel like I've asked most of my questions. Anything else on your mind?
I
before
think,
we start wrapping up?
I've gotten my questions out. I've
Yeah,
been
doulas are
very
cool.
satisfied.
You guys are cool.
Yeah.
This is fun.
Yeah.
Anything else on your mind you want to say before we start wrapping?
I was gonna say, would you get a doula if you were to
have a kid?
have a child?
100. I mean, 100%.
Yeah.
Yeah. It'd be weird if you were like, no.
No.
I don't like people
not
in my
worth
career.
it.
I
Not
don't like
worth
my
it.
career path.
Yeah,
like
but
people
yeah,
that.
I'm not sure if like childbirth is in the cards for me. I'm
Sure.
I'm just
Okay.
not sure. But
Sure.
but if I
you
do
do, yeah.
go down that
Like,
route,
absolutely.
like I want a cozy ass room, like
Yeah.
really kind, like warm people.
I love it.
But yeah, the last thing I just want to say is just about equity in like birthing and like the discrepancies in mortality rates among like across race are horrifying.
Yeah. Insane.
And there are a lot of amazing birth workers like Black midwives and doulas and indigenous midwives and doulas who are we have to listen to them.
Yeah.
And so I can't speak for like I can only speak to my own experience,
Right.
but anyone who has any like if childbirth is relevant to your life, which I think it's relevant to everyone, even if it's just like a little bit,
Right.
to seek out forms of, like seek out knowledge from
Yeah.
like and like expertise from
experiences, yeah.
like
Yeah.
lived experience is a very real form of expertise.
Nice. I love it.
And so I just want to
Yeah,
encourage
but-
people to
Look into it. Yeah.
be curious.
Open your eyes.
Open your fucking third eye,
Third
man.
eye, dude. Danielle, where can we find you? You're also a comedian. You gotta plug yourself.
Yeah.
Yeah.
Follow me on Venmo at female intern. Yeah, no,
That is a spot.
I'm on Instagram, female
Nice.
intern.
Love it.
Shockingly that handle wasn't taken.
It's
so
a good hand.
I like it. It's fun.
It's fun.
Yeah.
One last thing before we kick you out
Yeah.
forever.
Yeah.
Something as a little palate cleanser. Something we ask all of our guests.
Cool.
Can you please describe your perfect day? We're talking about 24 hours. What do you do? What are you eating? Who are you seeing? What activities are you doing? Only constraint, 24 hours. What are you doing?
Okay.
Yeah.
Okay. Wow.
Yeah.
I love this. Wow, I love this.
It's an amazing
Okay.
question. One of the best questions we ever asked, I think.
Yeah, really, the only reason we do this
podcast. Yeah, we're just like, we got to wait until an hour, and then we get the best. Yeah.
So one question is, do I need to tell you that, like, does it need to be in a linear fashion?
No,
or
you
can
should start it at the end and then be like, how did we get here?
It's up to you.
Okay,
I mean,
fine,
Record
fine,
scratches.
fine.
As long as we get an
Okay.
idea of a full day.
Okay,
Yeah.
okay, fine. Ideally, waking up in like somewhere in the 7 hour.
It's like
Okay.
7 a.m.
7:30, yeah,
Okay.
like 7:30
Early.
in
Wow.
in
Nice.
the sevens, okay,
Nice.
right? Like get
In the sevens.
ideally, hopefully
Yeah.
we've gone to sleep. We had a nice night
Right,
of
right,
sleep.
right. Perfect day. You had a nice night's sleep.
Perfect
Right, right.
day starts off rested.
Great.
Okay, I'm rested. Get up, do some morning pages. Actually, first I brew some coffee. I love
Okay.
Oslo coffee. I'm
Okay.
fancy as
Okay.
fuck, okay, and I
Interesting.
like.
What's your brewing method?
Okay, I have a grinder.
Yeah, nice.
I think it's Cuisinart.
A
They
cuisine,
want to
yeah,
sponsor.
classic.
Yeah, and I use a French press. I would like to
Mm-hmm.
learn how to use an AeroPress, but in my ideal day, I already know how to use an AeroPress,
Yeah.
so I'll brew it that way.
It's very easy
Yeah.
to use, by the way. You should get one.
That's what I hear, but like I watched a lot of YouTube. Whatever. If we can
We-
kind of
we'll
like do a
talk
little
about it.
tutorial.
We'll
cool.
talk a little about it.
Okay. brew some morning coffee with some like creamy oat milk. Hell yeah. Do some like morning pages. Are you guys familiar with the book The Artist's Way?
Oh yeah.
Hell yeah. So write a few pages.
Nice.
It's a great book. Do some morning pages. Okay, then I maybe make a fun, like a nice, nutritious breakfast.
Love
As
it.
we've been
Like
over,
today.
I really
Yeah.
like breakfast. So
Yeah.
that would probably involve eggs,
Nice.
maybe some meat, like maybe a sausage
Yeah.
or something.
Avocado.
Get in those
Love
healthy
it.
fats. Maybe
Nice.
sprinkle on some Trader Joe's everything
Oh,
but the
that
bagel.
Stuff is good.
Yeah.
That stuff is good. I have some in my pantry. Yeah.
Hell yeah, you do.
Hell yeah.
You know
just
what's
knew.
up.
You just saw it. Yeah.
And yeah, some veggies. Okay, cool. We have some breakfast.
Nice.
Some things I'm gonna want to get done on my perfect day.
Love it.
Some movement. Okay,
Okay.
so maybe that means a yoga practice. Maybe
Nice.
that means some high intensity interval training. Maybe it means taking a goddamn walk for once.
Okay.
Um,
It's a walkable city.
It's pretty,
Yeah.
pretty intense.
That's a pretty intense. Yeah. Goddamn
okay,
walk for
a
once.
goddamn walk for once in my life.
Yeah.
But although I will say I do like to do walks in the evenings. I
Mm-hmm.
know this sounds a little creepy, but like I'm a little not like peeping Tom. Like I don't care if I see people, but I love like
voyeuristic.
seeing people, like people's lighting fixtures.
yeah.
Like what
People
kind of
also don't close their curtains.
they don't
Right.
close their
So you
curtains,
can't
and I'm
see
like
into
I'm gonna
them.
judge you for having LED light bulbs. Like
Yeah.
that's a weird choice. So
You're very much about the vibe of the
I'm
place.
so about the vibe,
Interesting.
lighting. I'm so
Yeah.
sensitive to lighting.
Okay.
Um,
Sorry about this harsh lighting.
No, this is great.
This is a production.
what you
is a
guys have
production.
done here.
It's incredible.
Yeah. Okay. Another thing I'm gonna want to do on my
Yeah.
perfect day is play some music. I play upright bass.
That's right.
So I'm gonna want to practice some of
Just
that.
talking about the upright bass last night. We'll
Really?
talk more. Yeah, we'll talk more.
Okay.
more.
Okay.
Yeah,
Okay. Off pod.
Yeah, off pod.
I'm gonna want to do that. I would love to spend some like quality one-on-one time with a friend. That is like a big
Love it.
way that I like recharge and just feel seen and
Yeah.
loved. So I'm gonna want to do that.
Which one of us would you want to spend time with?
Ooh, what a good question. I mean,
Put you on the spot. I know.
Wow.
Sorry, but you have to choose.
One of us is gonna be hurt.
Yeah.
Yeah,
Well,
I
I'm already
am
hurt. The
the-
fact that
yeah,
you're
the-
thinking about it so long, I'm already hurt.
Yeah.
Whoever you don't pick will hurt themselves.
Yeah,
too.
yeah,
Okay.
yeah. So be careful.
I like that it's open to chance.
Yeah.
The answer is neither.
I
think.
can't. Yeah.
That's a better answer.
That
I
is
think.
a
Well,
That's
I think I would try to see if I could hang out with both of you. Which
Oh,
cop out,
okay.
but
That's fair.
Who you sing
but
first?
this is fun. So, who am I texting first? Hey, Fernando.
Yeah.
Yeah. So I can't decide. I'm gonna have to decide that in
That's
the
fair.
moment.
That's fair.
Okay.
That's
Okay,
fair.
which one
fair.
of you?
Yeah, yeah.
I'm very conflict averse, so I'm just
That's fair.
gonna
No, that's
not
okay.
answer the question.
Also, seeing people is very. It's
a
about the
lot.
vibe, you know.
It's
a whole
thing.
Who do you want to see?
yeah.
At the mall?
Which one of you is like better at lighting design? You know.
That's that
Yeah.
guy right there.
Yeah.
Okay, well then
Honestly,
it's
I'm a
probably
little bit-
gonna hang out with
That's
Art.
fair. Yeah, yeah.
Yeah, that's
Okay.
fair.
That's a good reason. I think not to like. It's not a personal thing. It's more just like who has skills. So that's fair.
Who's gonna like help my oxytocin flow?
That's Fernando for sure. Not me.
I want to go to a bookstore, preferably a bookstore cafe hybrid.
Oh,
okay.
There's one near here.
The
Fiction Center.
Hell yeah.
Have you been there?
I love that place.
Oh, that place is sick. Yeah, yeah.
It's so cool. Yeah, a place like that. I'm very love to park in a bookstore for like a couple hours.
Okay.
But used to do like a Barnes and Noble, but that was before. Like, there's other places.
Yeah.
There's
Yeah.
other cool places.
Sure.
And then I would love to see some live music.
Love
so
it.
I do like jazz,
Nice.
but like anything that's like groovy.
Yeah,
So
yeah,
Okay.
Moving on a little
some
bit and into it. Yeah.
yeah.
Okay. Cool.
Maybe we could like go have dinner at this restaurant called Fonda. I don't know if you've ever been there. I think it's in
heard of
Park
that.
Slope.
I've
It's
heard
like
of
some
Fonda.
fancy
Never
sort
been,
of like
but-
Mexican
I've heard of Fonda.
fusion place.
I'm into it already.
It's really
He's
tasty.
Mexican. There you go.
Yeah, technically.
That's not the reason why he likes it, but Anyway.
It's really good.
yeah.
Art's always
Um,
telling people I'm Mexican, just like he's just
Yeah, I just
saying to
wanna-
people on the street.
It's more for me. It's
Yeah.
more be like I have a Mexican friend.
He's announcing it constantly.
Yeah.
Yeah, I'm a creep. Anyway,
Yeah.
that's fun.
But yeah, I think like having enough room to like do all the things I'm curious about in
Yeah,
a day,
sure.
but also like have some downtime.
Yeah.
So I wouldn't be like too packed, like back to back activities,
Yeah.
but
Right.
yeah. Does that
And then you end your day just chilling and
And then I would end my day right. So I'd probably see some live music, come home, probably like smoke some grass.
nice.
Giggle to myself for a little
Yeah.
bit. If my roommate's around, I would love
Giggle
to
with
giggle in her
them.
company.
Love it.
Yeah, I love ending my day hanging out with my roommate. She's like really
great
dear
way to end it.
friend.
Great.
We're
Yeah.
we're tight, like it's fun.
Great. Great, perfect
feel
day.
loved. Yeah, it's just it would probably
a
be
chill
relaxed.
time.
Yeah.
I love good food.
Yeah.
Hanging with people. Hanging with friends.
Yeah.
Someone once told me it's strange that I'm friends with my roommate, and I was like, it's strange that you're not
friends
with
with
your
your-
roommate.
yeah.
Well, I mean,
You live with this person.
everyone is so different. I'm very lucky. Like all of the roommates I've had, like since graduating college,
Yeah.
I've always lived with one person. It's always been like one of my closest friends.
Yeah.
Which that works for me.
Right.
Yeah.
I love it.
Domestic
a great way to live.
partnership works for me. I
Friendship,
love that.
friendship in a living space is good.
My
Yeah,
my roommate's
friendship.
also. I met him last year. We moved in together last year. Became one of my
From this
closest friends.
podcast.
From this podcast. Yeah.
Crazy. This
So if you
podcast
want to be
changed
roommates,
lives.
Wow.
apparently it's a great track
Okay.
record for building
Yeah.
Oh my
roommates.
God, that's
Again, this is
that's
the
very
Rory
beautiful.
Scovel podcast.
This is the Rory.
To bring it all together.
Oh my God, I want him to be my mentor so badly.
Yeah. You can probably hit him up. He's probably just
I
chilling.
probably could.
Anyway, thank you so much for doing this.
Thank you
This
guys
is
so much
fun.
for having me.
I learned a lot.
No,
Yeah.
you're
Doulas.
great. You're
It's
fantastic.
great.
Yeah.
Hell yeah.
Fact check me. Like,
Yeah.
listen to some other doulas too.
Right.
We'll
get other doulas on
but
as well. Yeah.
but yeah, this
Cool.
was so dang
Does it feel
fun.
good? Yeah, awesome.
Yeah.
Thanks for doing this.
I'm gonna have to re-listen to the episode because I did zone out for a couple hours.
yeah, I
but-
didn't know what you
I
said.
actually wasn't listening to anything you said, but it was really fun.
It sounded nice.
Yeah,
That's
cool.
all that counts. All right.
Yeah.
Well, thank you so much for doing this. You want to sign us off?
No, you do it. All
All right. I haven't done it in a while. Guys, thanks so much for listening. Catch you guys on the next one. See ya. Fernando.
What's up, Art?
What an ep.
Yeah, honestly, that's the. I know I said up top that me and Danielle were good friends. That was honestly the first time that I met her was on that podcast, and and I will say that she is a well, not a great person. She is a delight all the
Yeah.
same. You know?
Danielle Deluty.
Yeah, Danielle Deluty, if anything. Yeah.
Deluty.
Yeah.
Yeah, that was cool. I don't know if I want kids, to be honest now. I'm thinking
What?
about it. I woke up feeling
What
like
are
I
you
wanted
talking about?
kids, and now I'm like,
It's
that's a lot
after
of
like
work.
a 1 hour conversation.
Yeah. And like, I just don't want her to get work, is
Yeah.
what I'm trying to say.
Okay, so you're just trying to put a woman out of work, is what you're saying.
Yeah, dude.
Art's
That's
so
exactly
against,
what I'm saying.
yeah. He's against women's suffrage. He's against women in the workforce. He's against.
We could be doulas. You know, we mentioned it on the pod. I think
We did,
actually
yeah.
do
That,
it.
yeah. I was just like, because I am curious as to how many like men are actually
Doulas.
doulas.
I feel like it's one of those
That's
things
such a
where,
fun
like,
word to say. I
doula?
kind of want.
Yeah.
I become a doula just to be like, I'm a doula.
Doula. It
Du-
has like it reminds me of gondola. You know how I said up top, I was
oh.
like duva and a douche, but I'm like,
Yeah,
now it's
you
like
said-
gondola, you know?
I would say that it's
Gondola.
more similar to gondola, and I will be honest, gondola is less gendered, so better pool.
I mean, not to plug other podcasts, there's a great episode on Radiolab about how in Italy, in Venice especially, all the gondola rowers are traditionally men and passed down from family to family. But in like the 2010, 2008, there was the first woman gondola rower.
Wow.
And she like broke the mold, but then she came out as a trans man. So
Wow.
it's like there's still has there ever been a woman still? Maybe not, you know?
Yeah.
So it's
I guess it
interesting.
depends on how
It's a really good
progressive you
episode.
are. How
Right. And like what
How
gender
progressive are you? Are
leans
do
to.
you consider there being a first woman? Do you consider that being the first woman?
Well, I prefer
Please answer it on mic right now. No, don't try to give any context.
Well, I
Just
prefer
answer.
I prefer
Do
the
you- do
term
you
first
think-
lady.
Do you think it's the first lady? Do you think it's the first woman? What do you
I
think?
don't know. I mean, the whole podcast is about like no one really knows, and I feel like I'm with.
But
them.
I'm
like, I don't
asking
know.
you what
I really
your
don't know.
opinion is.
What do you think?
Well, see, I don't touch topics like this because they're a little too murky for me. But
Anyway, back to doulas.
yeah, back to doulas.
I don't think there's ever been a first man doula, and I think we should do that.
There probably are male doulas.
Name one.
I mean, I can't name more than one doula.
doula
so-
right now. You know, one doula. But anyway, I think we could be good at it. I think it's just like, it's one of those things I feel like women probably like prefer like women gynecologists,
Yeah.
that sort of thing. But there are male.
I don't know. I have a lot of women stepping into my office, trying to get that pap smear. So
Oh, do you get yours, dude?
that was rough. I'm sorry, guys. That came off in a way that I did not intend it to. That came off in a really weird light.
Yeah, that was.
That was a lot.
I felt it. I felt it as soon as I said it. I got a little too flagrant. I was having too much fun.
You're gross.
Yeah, that was disgusting.
You're a gross person.
I'm sorry. But yes, women do prefer women gynecologists, and it's because of men like me. So it's,
yeah, sure. But hey, I think we'd be very supportive. I think we'd be pumped about it. I think childbirth is like beautiful. Again, I talked about it on the pod. I probably would cry a lot.
Yeah,
so.
I think from what Danielle was saying, it's just about you have to be a chill person, kind of be a chill, and also be like she was saying, just be willing to take a step back and realize that like this is not about you in any way or shape or form, which is obvious, but I do also think is something that people might also struggle with.
Sure.
Because
it also would be hard for us because we're just two narcissists talking, you know?
Oh, I mean, yeah, for sure.
But hey, I love the baby, but I'm having a good time.
Yeah.
I'm going to make this about me.
Yeah, you should, yeah. But can you name it after me?
Yeah. You know what I'd love? I would love setting up the room. That sounds so fun. Like the twinkly lights, like make sure like the lights like nice. And, like,
I really
nice,
do
like,
think people would just set it up Dexter style. Just like saran wrap and stuff all over the walls.
I mean, you maybe.
Yeah.
So the cleanup's way easy for everybody.
Yeah.
That's gross. Anyway.
Honestly, yeah.
Great talk.
Great talk. Love Danielle.
Love Danielle. Sorry for comparing you to a stork, but you know, it's hard not to.
I'm also really sorry for that pap smear comment. If anybody's
Still
listening.
Thinking about it.
Yeah, I'm spiraling. I feel real guilty. I was trying to paint art as a sexist at the top of this podcast, and I will say that now I have ousted myself.
Yeah.
As also a sexist. But it is about just acknowledging your flaws so that you can then address them.
Yeah.
So please work with me and give me time to work through this as
hard time. Yeah.
Yeah.
Well, it'd be nice if you wrote out like on your notes app a little apology. So you can send it.
I mean, I'm reading it right now.
Okay, I got it.
Okay.
You just typed it up. That's so fast. Okay.
Yeah.
I like at the beginning.
I write a lot of apologies. Okay. I write a lot of. This was
copy and
pre-written.
pasted. Yeah. At this point. Yeah, I like how in the beginning you infuriated our incel demographic. Now you're infuriating our feminist demographic. I don't really know.
Yeah. I don't know. I don't know if it was like it was just a weird thing to say. So I just.
No, that's
I'm
cool.
I'm just sitting here twiddling my thumbs.
Women be lining up outside of my office.
Yeah, to get their pap smear. What is that? That's such a fuckboy thing to say.
Well, we'll open it up to the public and see how they feel about it.
Okay.
All right.
Yeah, please tell me if I'm a bad person.
Well, I think you already know the answer to that.
Yeah. Anyways, guys, thank you so much for joining us. You want to do it?
You got it.
Guys, thank you so much for joining us on this episode of Teach Me Good. I have been Fernando Reese, and there's Art Kai sitting across from me. And we'll catch you on the next one.